So, Madelon Finkel, you're up in Ithaca. It's very nice to see you in Ithaca. You're a professor of public health at Weill Cornell Medical College, and you've become interested in the area of how unconventional shale gas extraction from tight formations could affect human health. Tell me what, from your experience of the public health field, strikes you particularly about this new industry?
The parallel that I draw is what we used to see with the tobacco industry, when certainly there were little studies dribbling out that seemed to indicate the harm due to the product. And it took years and years, decades actually, and numerous studies to try and convince the industry that indeed the product was harmful to human health. So when you look at natural gas extraction, there's a void of health studies. There's no epidemiology at all. We have, anecdotal comments that this is hurting people in various different ways, but there's no hard science. So what we need to do is to create a body of literature based on empirical, well-designed empirical studies to show what is going on. So it becomes not just a he says, she says kind of thing, but the data will bear out if there is potential for harm, and if so, to what extent.
So this technology has now been going on in several states in the United States, in Texas and Colorado and other states. Why do you think it is that the public health profession has been rather late in coming to this?
There are little pockets of individuals doing small-scale studies, but it's a very good question. I don't know. And I think maybe the answer is it's so new. In other words, this is only since, let's say, the late 2000s, that we've actually seen a tremendous increase in the drilling production. Certainly the industry never built that into their, cost estimates of extraction of gas. But I think it was too new. We didn't quite know. It sounded good. It sounded clean. And now, since we have a few years of experience with this, and we are hearing of individuals potentially being harmed, now people are becoming more interested in looking at the issue.
So,
but isn't it a shame that it always takes, the people to get hurt, before someone is proactive about it? It's a shame.
It's totally a shame. So tell me, as an epidemiologist, how do you start looking at something like this?
Usually, it all boils down to two things: time and money. Or I'll rephrase it: money and time. So one way to do it is just to do some descriptive studies, ecological studies. What's going on in areas where there's drilling, what's going on in areas where there's no drilling, and then make some sort of comparisons. This is not hypothesis testing studies at all, but it's to raise questions from which then analytic studies could be designed. So the first thing really is to take a look at trend data before the drilling, after the drilling, and to see if there is something that merits further research.
And so those are the studies which people are starting to think about at the moment?
Yes, appropriately so. I don't think anybody's going to fund a group to do a cohort study longitudinally over time. Those are very, very expensive. We don't have enough experience to do a case control study. I think you need first the descriptive studies to take a look, as I said, pre and then present, what's going to happen. And from that, based on what you're finding, if there are differences, then you could delve into a more empirically based hypothesis testing kind of a study to answer the questions: is there elevated risk? Can we ascribe causation, association? To what extent is the strength of association between harm and the process?
Now, in your career, you've written a lot about epidemiology, public health, and public policy. In this area, we have at the moment an exponentially increasing industrial impact on a wide variety of geographies in the United States and beyond. Can you comment a little bit about how do you actually, when you have a suspicion that this may be harmful to human health, how do you raise questions about public policy?
Well, I think you need the evidence first. I mean, you can't go to your state legislature and say this is a terrible thing, it should be stopped, unless you have data to share with them that shows that there is something going on and they should tread more carefully. The process is the same whether it's in Colorado or Texas or Pennsylvania. I mean, the fracking process is the same. What we need to do, though, is to take a look at a lot of different issues in terms of using Hill's criteria, actually, temporality, dose response, does it make sense biologically? And then, based on the information that you're collecting, present it to the federal government, to the state governments, and say, now we have some preliminary information, which is certainly more than we have now, and I think we need to have an intelligent debate about what this process production of extraction of natural gas from shale is doing.
Well, you raised the point about Hill and earlier on about the cigarette industry, right, and how long it took really for the public health community to really nail that one, right, by which time enormous damage had been done to people's health and is continuing to be done to people's health.
Well, part of the problem too is, particularly if you're looking at cancers, I mean, they don't appear overnight. They take a long time to develop. Mm-hmm. And then can you relate back, ascribe the incidence of the cancer because of, in other words, but for the smoking, would I have had lung cancer? Same thing with the natural gas extraction, but for the drilling, would I have developed these health problems? And so teasing out strength of association, teasing out causality is very difficult.
But we do know that many of the chemicals used, the ones that have been disclosed at least, in creating slick water and drilling muds, and also the flowback which comes from the ground, contain real well-known carcinogens, toxins, endocrine disruptors, a bunch of other things. How important is understanding pathways of exposure to an epidemiological analysis?
It has to make sense biologically, for sure. So, we know these are highly carcinogenic. Not everybody exposed to benzene is going to develop a cancer. Not everyone exposed to all the other toxic chemicals in the brew will get sick. So you need comparisons. You absolutely have to have a comparative study where you're looking at people who have the same opportunity, if you will, to get sick. Some will, some won't. So statistically, we can then assess strength of association, risk, and then make some determination. But you have to do it by comparisons.
Now, physicians, scientists, and engineers for healthy energy is fundamentally a science-based, evidence-based organization. It is multidisciplinary. Could you comment to me on the importance of being evidence-based in addressing questions? Because a lot of people are saying, well, we've got these toxins, we've got populations that are potentially at risk. We should stop things right now. What is the role of evidence and science in policy?
Well, I think the industry is going to demand it, as the policymakers should as well. In other words, you need to present the data before you can make your case to say, now we should stop it. Because the industry will fight this, of course. And what you need to do is to have well-designed studies. That's the key, methodologically rigorous studies that will then be able to show with some certainty, that there is an elevated risk associated with this production and human health.
And in terms of your own profession, in the public health domain, evidence-based medicine has become very much a way in which professionals, physicians, survey the literature of what they're doing to determine how to practice medicine. And we're now hearing about evidence-based business practice, and the whole approach is moving elsewhere. And it really came out of epidemiology, isn't that correct? Sure. So from your point of view, the public health approach, does that have something to teach the rest of the evidence-based sciences in terms of the way in which professions and industry even go about looking at risk?
But you're right that PSE is multidisciplinary, which is wonderful because you're bringing in geologists and engineers and physicians and epidemiologists and mental health specialists and so forth, and everyone has a little piece to add, you know, to this puzzle. I would assume that the studies that the geologists do are rigorous. You know, I'm not a geologist, so I can't speak, you know, confidently about what they do and how they do it, but certainly I can speak from the public health medical side, and it would be good to see, you know, replication of studies. One study is not going to tell you the whole story. You need to see from other studies whether there's a pattern that's emerging. So, you know, you keep using evidence-based medicine and so forth. I would like to, I suppose, change the term just to say methodologically rigorous.
Okay.
I think that has to be done. These can't be anecdotal type of studies. That's not going to be helpful. You have to make sure that your study population is generalizable, appropriate. You know, that you're not dealing with people that only want to talk to you, because what about the people that don't want to talk to you? You know, what are they not telling you? It has to be methodologically sound.
And what is the importance of this research appearing in peer-reviewed journals? What's the significance of that?
Well, I think that's the gold standard for anybody who's trying to publish, that it's been assessed, evaluated by peer reviewers who hopefully have some insight into either study design or the issue. And I always tell my students that there's a journal for any article. You know, you can always find it. So you want a higher level, you know, pecking order, so that you get it published and people will stop and take notice that this has been vetted by peers. It was worthy, you know, to be included in the journal article, and from there you can go with greater strength, I think.
To policymakers.
To policymakers and the government types, yeah. No, you definitely need to do everything correctly. It's a step process. And you need absolutely to see consistency in findings and replication, because if one study shows one thing and all the other studies show something else, you're the outlier, that you're not going to be taken seriously.
Thank you very much.
Pleasure.